to Health Alert. I'm Pam Butler. Today we're going to talk about a variety of subjects related to nutrition, and joining me is Amy Puls. She's a registered dietitian with Morton Comprehensive Health Services. Welcome.
Thank you.
Now, before we start, because you've been on the show before,
yes,
but people that may not have watched that program, just give us a little overview of the difference, I think it's important, between a registered dietitian and a nutritionist.
Okay. A registered dietitian is somebody who has a degree, either an undergraduate degree in nutrition or a master's degree in nutrition, and has completed a training of 1 or 2 years, and that's an approved internship. Okay. And within that internship, they meet all the criteria to sit for a board exam that allows them to call themselves registered dietitians.
Okay, and then the nutritionist,
can be anybody anybody who's interested in nutrition can call themselves a nutritionist. So there's definitely a lot of people out there that call themselves nutritionists, but they're not necessarily a clinical dietitian where we really specifically write specific diets for our patients and for physicians and treat disease specifically.
Okay. Now I want to start today, we're going to talk about sort of a variety of areas that nutrition is very important for, and I want to start with what we call the picky eater.
The picky eater, yes.
Especially with the little ones. It seems like maybe if they only want to eat oranges and they don't want to eat absolutely anything else. Tell us a little bit about picky eaters. To start with, is that really a big problem among kids?
Well, and actually 2/3 of children under 6 are picky eaters. So in some regards, it's kind of normal. Okay. And so there might be a little hesitation in trying new foods, and a lot of that has to do with just confidence in knowing that they can spit it out if they wanted to, or swallow it. Or you get into problems with picky eating as kids feeling like they have to eat something. And so then they become less interested in trying new things, and that's where that parent-child relationship can get a little stressful. And I think that's where our traditional topics of picky eating come in, where parents are stressed out that their children aren't eating properly, and their kids are actually refusing to even try new foods.
Now, how should we even thinking about that? How should we even introduce foods? Because sometimes we could be going about introducing them too quickly, and the child really isn't ready for that, and that can be why we think they're picky. But what's the normal way to look at food introduction for little ones?
Well, for our infants, we like to introduce solid foods at around 5 or 6 months of age, and that should start with cereals and fruits and vegetables. And as their immune system matures around 8 or 9 months, then we can start increasing some of the proteins like yogurts, pureed meats, and more textures. So as their skills start getting where they're able to start self-feeding, then you can start introducing some of the table foods. And so that's where we get into a larger variety of foods that children can pick from.
Let me ask this question. Are there certain foods where we're introducing them that are known to be maybe more allergen prone that you would introduce later, or may have a problem? I remember so vividly, I probably shouldn't share this, but I won't say his name, but my older son, when he was an infant, I remember introducing corn to him, and I'm thinking maybe I did it a little bit too soon, because when we went on an airplane ride, there was this explosion of diarrhea that came all out of the diaper and everywhere, and it was just full of this corn.
Yeah,
and so he had a hard time with corn.
Digesting that specifically, and that may be just more of an intolerance. Like his GI tract wasn't ready for that type of digestion. And so the more fiber you have in your diet, the more your body has to kind of work at getting that nutrition out. And so sometimes babies just aren't ready for that, to where they need that. Really, that's why we give babies pureed foods, is that it's already kind of digested for them. As you get older, you get teeth, and you can do that for yourself. But for babies, you need to kind of break stuff down for them, and it helps them digest those foods better. So sometimes that's not necessarily an allergy. That's more of a
digestive intolerance. Introduced it a little bit too soon.
Right. So, and I think that people get nervous thinking that it is an allergy, and then they don't introduce it for a long time after that. Okay. Instead of just trying in a different form, like in a cornbread or something like that.
Are there certain foods that are allergy prone that you'd want to look at introducing them one at a time to see how the child tolerates it?
Well, the first thing is don't introduce nuts, and particularly peanuts. And especially in families that have a history of food allergies, we like to try to keep those out to well over a year, if not to the age of 2. No honey until after 1 year of age, and that has to do with that immune system not being mature enough in case there's some type of botulism in that in the honey. And so your immune system just can't fight it off under 1. So that's another one to completely stay away from until babies are older. Another one would be egg whites that I see as a common allergen. So the egg yolks you can introduce around 8 to 10 months, but the whites tend to be ones that you might see little hives, you know, around the mouth and the cheeks, and that's one that you might want to stay away from, particularly if you have a family history of food allergies.
Okay, now when we're dealing then with the picky eater, and we know what's kind of normal, that they're really not picky, because about 2/3 of kids really do, that it is their norm, and sometimes if we don't understand it's their norm, we sort of miscategorize it or respond so differently.
Correct.
And how to introduce these foods. Let me ask this question. If we have a child then that is really particular, that only likes a couple things, you'd mentioned before the child may feel that, you know, you get into difficulty because they can't spit it out, and and spitting out sometimes we don't like that as the adult. So how should we really approach that?
Right. Well, and when we deal with children that have really started limiting their diet to where the parents are really afraid that they're not getting the nutrition that they need, we actually encourage them to go to their doctor.
Okay.
Because of those children that are picky eaters, about 25% of them have feeding problems where they are very sensitive to textures, they don't chew correctly, they don't move things correctly around in their mouths, they don't like to maybe touch certain things, and so that can be treated with either occupational therapy, speech therapy, swallowing therapy, and really kind of strengthening up those feeding skills. So that really can be a medical problem. And so that's a good indication that you probably should go in, you know, at your baby's next or your child's next visit, or make a visit specifically to talk about their skills at the table. If that is ruled out as not a problem, that there's no indication that there's some medical reason why they're being picky, then you start working on that relationship. And the relationship of allowing children to explore their foods. We allow them to do that as babies. When we give them their foods, we let them spit it out, and they blow raspberries, and they finger paint with it, and then we kind of forget about that as they get older. And so we like to kind of pull them, some of those kids that have really limited diets, pull them back through those infant skills of learning how to eat, where they get to touch their foods, they get to play with their food. Sometimes they chew it up, sometimes they spit it out, sometimes they swallow it, and eventually they do. And so that's the trick to it, is allowing children to do what they do best, which is play, and that's how they learn.
And I'm thinking about how you would look at it, where you could even put the sort of the longer bib on, you know, put something around the floor, so that you don't get, as the parent or the caregiver, so intense with, look at this mess. I mean, you know, you settle down and let the child explore through that to get used to those things.
And I think there was a great article that Michelle Obama, her White House chef, is doing a whole campaign on getting kids to try new things. And one of his articles actually recommends that you let kids help you prepare foods. And that's what we encourage as well, is taking the celery stick and painting with the hummus and doing other things than maybe feeling like you're forced to eat it. Because, and it ends up on your fingers, and then you end up licking your fingers, and that helps you expose without having to feel like you've been forced to try it.
Okay, so we should relax as the caregiver to give the child the assistive skills to explore and to experiment, and maybe they won't be so picky in the end.
That's right.
But you stay put, and when we come back, we're going to talk about obesity.
Okay, great.
All right.
Thanks.
Please stay with us. We'll be right back. Welcome back to continue our discussion, now focusing on obesity. Joining me again is Amy Puls, a registered dietitian with Morton Comprehensive Health Services. Let's jump in here. Now, obesity, we hear a lot about it.
Right.
So from what you're seeing in your practice, is it really as big of a problem, especially among youth and even adults, as we are hearing in the media?
It absolutely is. And for those of us that really work with children who are obese, we see a conglomeration of problems that are happening to these children at a very, very early age. And so we're seeing structural problems with their feet and their hips and back pain, So, you know, just the skeletal system is stressed, but also metabolically, we're seeing things that we usually see in older adults. We're seeing hyperlipidemias, which is high cholesterol, high triglycerides, insulin resistance, and prediabetes, if not diabetes, by the time they're 20. So, in about 25% of our children that are obese, we're seeing prediabetes, and that's a real indication that they will develop type 2 without treatment within 10 years.
Now, with the onset of obesity, what are some of the contributing factors? I mean, our foods.
Right. Right.
Of course, more of a sedentary lifestyle for kids because they're playing the computer games and they're not getting out and being as active as they were before.
Right.
But foods have got to be a big contributor as well.
Absolutely.
So
Absolutely.
what are you seeing that they're eating, and what do we need to change or help them to modify, especially when you're dealing with older kids?
Well, of course, the big thing that we look at when I see children coming in and I look at their diet records and I ask them what they're eating, I see very high sugar, high fat diets. And those two things together actually dysregulate your body and how it uses and stores fat and uses blood sugars. Okay. And so when you get into that dysregulation, you don't store fat properly. And if you get too many calories, you store too many. So you get this kind of this, you know, this whole conglomeration of too much, just too much. And so you have too many fats floating in your blood system, too much insulin floating in your blood system, too much blood sugar. And that's where not only is it just the obesity, I mean, the obesity is a symptom of really the progression of disease. And so obesity is really related to hypertension, diabetes, and so that's where we look at kind of those cardiovascular problems and potential renal problems. And so it's not the obesity that we're really concerned about, it's the progression and the sign of obesity that there could be a dysregulation in the diet causing eventual really true chronic disease
now,
at an early age.
Let me ask this question then, because you may get kids who are and because their family is into a lot of fast foods and things such as that.
Right.
What kinds of things, other than stopping that altogether, which people sometimes don't do, would you advise that they look at when they're going into fast food restaurants? Because there are different varieties. Many are trying to become more healthy focused, but what should we look at? Because the other thing that I had read about was in Oklahoma, we're one of the test markets for new fast foods.
That's right.
Which is frightening because we are known to eat at that level. So everything that comes down the pike that's a test kind of food, we get it, and it's not necessarily a healthy thing.
Right, and you kind of lump fast food into, I kind of lump it all into even chain restaurants. So they all serve fairly similar types of foods in that the foods are high in fat, they're high in sodium, and you tag on a sugar drink or some dessert or some ice cream or a milkshake, and you've got that perfect storm like I was talking about of a high sugar, high fat diet that causes that down the road chronic disease. And so here in Oklahoma, our food environment is really hard to navigate. It's really hard to drive by McDonald's and go home and make a turkey sandwich. And that's the secret to childhood obesity. It's not that people don't know what to do. They know they should eat more fruits and vegetables. They know they should have more lean meats and whole grains. But it's so tempting to just zip through the drive-through and pick something up really quick.
Well, if they're going to keep doing that, because they are, what do you have them focus on in the restaurant or at the fast food place? Is it, instead of biggie-sizing everything, do you get the kiddie meal, or you start with a small fry instead of the large fry? You ask for it without salt. I mean, what kinds of things can we do?
Portions definitely help. I also encourage families to be armed and know where they can eat out within some frameworks. And so when I talk to my kids that we're trying to get in better shape and eat healthier, we look at calories, because calories are everywhere. And when you look at a calorie range for where your meal should sit, and I tell my older kids, my adolescents, somewhere between 350 and 750. For your younger kids, their calories should sit somewhere between 350 and 500 calories at a meal. So if you're going out to eat and you're opening the menu and the salad that you thought you were going to order was 1,260 calories, you know, either you should eat half of it or you should look at something else to order.
Okay.
And so that's where the publishing of nutrition information, specifically calories, can be very helpful for families because they can see where is it going to be easy to eat out and where is it going to be really hard to get in that zone.
Now let me ask this other question. A lot of times in restaurants you have a lot of the little heart symbols next to menus.
Right.
Should we take that for the truth and nothing but the truth, so help us? Or do we need to still really ask what's the caloric intake, what's the salt intake or that? Because there might be a little fudging going on a little bit.
Absolutely. It's up to the person preparing your meal.
Okay, so we should ask.
Yeah, you should definitely ask. And if it's something that could be added liberally, like salad dressings, mayonnaise, things like that, ask for those on the side because you can also control those factors in your meal. Those heart symbols, sometimes you see them as green checks as well. Those are standard for heart healthy. And what that means is that 30% of the calories in that meal come from fat or less. And so that helps you understand kind of what's in your meal, that you're getting probably some good whole grains and some, or at least some carbohydrates and some proteins, but you're really limiting those fats. That's also important for knowing what your portion sizes are going to be. If you have a meal that's really high in fat, your portion sizes are going to be really small, because fat is twice as dense in calories compared to protein and carbohydrate. So that can also help you kind of shop savvier to make sure that you're going to get a good portion for what you're paying for.
Okay, and that's important too, because sometimes we think, oh, they gave us that little bitty piece of, you know, and when we think about it, the meat size should be no bigger than the palm of your hand, right? I mean, we look at those kinds of things to look at what's a half a cup. It's not as big as you think.
If you compare your basic fast food hamburger, French fry joint compared to someplace like Subway. Subway has a lot of green checks on their menu, and the reason is that their foods tend to be low in fat. If you go to Subway, you can get an entire Subway sandwich, sometimes with a side of fruit and maybe a milk, all for within that zone, that 350 to 500 calorie zone. If you go to McDonald's, you're looking at a half of a hamburger, a half of a small fry, and maybe a little bit of a drink. And that's it. So your portion sizes are so much smaller there. And so that's why that savviness of knowing what you can get for your money is really important, and those checks can help you out with that.
Right, and that can help us sort of curb the overeating and that type of thing.
Absolutely,
and I do
it's really tempting to not divide it.
And I do want to share right before we go to break here is that went to a restaurant and asked for the salad dressing on the side, and the waiter said, I don't think we can do that. So you have to be an advocate for yourself.
Absolutely.
And I said, yeah, I think you can do that. So,
you can try.
So I did get my stuff on the side, but I did have to insist that I have it on the side.
That's good for you. That's a good skill to have.
Exactly. Speak up for yourself in this area. So we're going to take another quick break, and then I want to come back and look at athletes in relation to this nutrition issue.
Okay, great.
Okay.
Thank you.
Please stay with us. We'll be right back. Welcome back to complete our discussion talking about nutrition in various areas, this time looking at athletes. Joining me again is Amy Puls, a registered dietitian with Morton Comprehensive Health Services. Let's jump in. Now the athlete, I mean, whether you're the weekend athlete or whether you're the finely tuned athlete, tell us a little bit about how, if we're going to be involved in athletic kinds of things, especially for our kids, how should we look at approach to general nutrition for them? Do they need a lot more fat? Do they need, I mean, tell me.
Do they have a different diet?
Yeah, do they have a different diet? Tell me about it.
Overall, no. Their recommendations are very similar to what we would recommend for anybody. A low-fat, low-sugar diet, lots of fruits and vegetables, good complex carbohydrates, some lean proteins, and especially we like to see more plant-based proteins these days. So really, the overall recommendations are very similar from what we would even recommend for adults to children. So specifically with more higher endurance athletes, those recommendations definitely change. And that would change after the first hour of exercise. So if your child exercises for 2 hours or 3 hours or is in a high endurance sport, that's when the nutrition recommendations change.
Is that where we would look at more fats that they would need, or is that where the sugar type things become okay because they're going to burn it off? I mean,
it depends. It depends.
How do we look at that?
Everything in nutrition is, you know,
yeah, it depends.
It depends. If you don't know the answer, you say it depends.
Okay.
And it really does. It depends on the athlete, and it depends on the situation. Okay. So we never really advocate for a high-fat diet.
Okay.
Hardly ever. So there are very specific cases where we might increase fats, but that's on a clinical side. In the general population, we never advocate a high-fat diet. Now, protein and carbohydrates are where athletes really need to focus. They need to make sure that when they're getting their servings of carbohydrate, they're coupling those with some proteins. That protein helps to slow down how fast you process those complex carbs and make sure that you're storing those and using those really well. We used to carb load 24 hours in advance of an event, and now we look at the long-term ways that we're storing our carbohydrates. So really, carb loading should start 5 to 7 days before a major event. And that means that every time you're eating, you're really eating a good source of complex carbohydrates.
Okay, now give us an example, because some of us may think we know what those good carbohydrates are that are complex, but what are some things?
So a complex carbohydrate typically is something that's not sweet. So your starchies. And these can be anything from cereals to bagels to breads and pastas and rice and tortillas. Things that are starchy in texture, those are your carbs. And those are really packed with the good energy that you really need for your muscles. Your muscles burn the majority of the glucose in your body. That glucose comes from carbohydrate that we eat. Now,
is there a difference, because you mentioned about rice and pastas? I mean, we have brown rice, we have white rice. In the pastas, we've got wheat pasta, we've got all kinds of pastas.
Right.
Is there a distinction or something we should consider when we're looking at what's still a better nutritional selection from that range?
So when you're eating the whole grain, you're getting all of the nutrition. When you get a refined carbohydrate product, so like wheat bread tends to be more refined than, white bread tends to be more refined than wheat bread. What they're doing is they're kind of pulling that wheat kernel apart, and they're just using that inside starchy part. When you have the whole kernel and they're using the whole kernel, you're getting all the vitamins and minerals and all of the fiber. Now that fiber helps to prevent us from overeating. The more you chew, the more fiber you have in your diet, and really the more intact nutrition, your stomach has to kind of work harder at getting all that nutrition out. So you tend to be more satisfied longer. So that kind of helps, you know, if you're incorporating more carbohydrates in your diet, but you're afraid you're going to overeat, definitely do the whole grains, the brown rice, the whole wheat breads, whole grain bagels, things like that will help you from overeating and not getting too much.
Oh, okay, that's interesting, because I had a wheat pasta the other day. The first time really on the pasta side, I tried that, and it was a little bit different, but it was still good. But you do have to sort of get used to some of the differences in the taste and the texture, right? But once you do, you've got it. It's not a problem.
Yeah, good.
Now let me ask about something that we see athletes with all the time, sports drinks.
That's right.
How should we view sports drinks? Because we feel that they're all very, very healthy for us.
Right. And there's nothing that hydrates like water. Water is your best hydrator. Now, there is indications during long duration of exercise, that little bit of glucose that you get in some of those sports drinks, just a little bit, you don't need all that sugar, but a little bit of that glucose helps to pull some of that water in during exercise. But outside of exercise, you just need plain old water. Okay. So if that helps, you know, parents know when do kids need Gatorade or some type of sports drink. They really should be doing it if it's, you know, an hour or 2 hour event, during the event only. During the event only,
yeah, because sometimes we drink it all the time.
Right.
And we think it's a pretty okay kind of thing.
Yeah, yeah, and it's just sugar.
It's just sugar.
It's just sugar. Yeah, just sugar and maybe a little bit of electrolytes, but it's mostly sugar.
What about the additives, like products such as Crystal Light or other kinds of things? There's many out there, but that one came to mind. Adding that to your water.
Well, and that, you know,
because it is basically water.
It is basically water. Sometimes it helps children drink a little bit more, but they don't need that all the time. learning how to drink water can be just like a skill of like you would teach reading. Encouraging your children just to drink plain old water is a really good skill for them to have. And water's everywhere, it's inexpensive, and you don't just need all that stuff.
Okay, so back to water for your basics. Unless you're actively involved in an activity or a sport, then you might look at adding a little bit extra.
Right. Now the importance of fluid has to do with keeping you hydrated throughout your event. Okay. And the reason why we like to make sure that children are really well hydrated, especially here in Oklahoma, is to prevent things like heat stroke. And there's a certain type of heat stroke that athletes are very prone to that's not just like I got overheated standing around. They can be more prone to something called exertional heat stroke or exertional heat exhaustion. And that has to do with the core temperature of their body becoming too hot over really 104 degrees Fahrenheit. And when you get over that that amount of heat, your organs will shut down. And so a way to protect children from that is if they're exercising and it's over 82 degrees outside, make sure that you're giving them plenty of fluids. If they like the Gatorade better, give them the Gatorade. But you need to keep them hydrated. But also before that event, that 24 to 72 hours before the event, you need to make sure your kids are drinking lots and lots of water to protect them from that type of heat exhaustion.
Okay, sort of to get them ready.
Right.
Now during this, because sometimes we hear about athletes, especially with hot weather and back to practicing and things like that, how often should they have a water break? Because also there's the concept of don't wait until the child says I'm thirsty.
Correct.
So we, as the adults, should be planning water breaks, fluid breaks. How frequently should that be? Once an hour, every 2 hours?
Probably once every 15 to 20 minutes.
Whoa.
Actually.
Okay.
And so here in Oklahoma, our kids are very prone to becoming overheated. And during that event, it should be as often as possible. Okay. And they should be keeping themselves really hydrated. But that water or whatever they're drinking can also cool the core of their body and make sure that they don't get overheated in their trunk. Okay. It has nothing to do with, a lot of people feel extremities. If kids don't look like they're overheated globally, they forget about the core of their body really needing to cool off. Okay,
thank you so very much. Very good information. Thank you, Amy.
You can get more information about heat exhaustion related to sports on the Corey Stringer Institute. It's through the University of Connecticut, and they have a whole website for parents that are interested in preventing stroke and exhaustion.
Thank you so very much.
You're welcome.
Well, that's our show. For Health Alert, I'm Pam Butler. I'd love to hear your questions, suggestions, or comments. Please write me at Health Alert USA, P.O. Box 50913, Tulsa, Oklahoma 74150, or if you're on the email trail, please email me at healthalertusa@gmail.com. And also visit me on YouTube at youtube.com/healthalertusa. And remember, look into your foods, be patient with your children, sort of enjoy, play through the dinner as they need to, not as you need to. And then also pay attention to your athlete and what is really, really needed. Take care.